Good morning, everybody. Tuesday, the 2nd of February. Welcome to our Silly Local Outbreak Engagement Board. This will be a virtual meeting with remote attendance by councillors and other members of the board, with remote access of press and public, and will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus, flexibility of local authority and police and crime panel meetings, England and Wales, Regulations 2020. So I'd like to welcome you all, and we'll start with agenda item 1. Are there any declarations of interest?
Just to go through the roll call, as I say, we do have an anonymous on the screen at the moment, and it just in case their presence needs to be noted by Andy Thomas.
Yes, no problem. Would you like to carry that out then, Stephen?
Oh, certainly, Chair. Yeah. Councillor Mrs. Rottick?
Present.
Councillor Harry Legg?
Yes, present.
Councillor Joel Williams?
Present.
Captain Clark?
Present.
Mrs. Langdon?
Yes, good morning.
Mr. May?
He's given his apologies, thank you.
Thank you. Sergeant White?
Good morning, present.
Thank you. Dr. Wigglesworth?
She's given apologies.
Are you standing in, Whitney?
Yes, Whitney Curry in for Public Health.
Thank you. And Paul Charnock? No? Okay.
Yeah,
Is anybody else who...
Paul is, yeah, he's on mute, Stephen, but Paul is here, I can see him.
And wishes to signify their attendance.
Yeah, Steve Sims.
Thank you.
Hello, Tanya Saker.
Thank you.
Paul Masters.
Thank you. That's it. Okay. Thanks, Kevin.
Okay, thank you very much. So are there any declarations of interest? No. So item 2 on the agenda are the minutes from the previous meeting on the 12th of January. Are there any issues surrounding these minutes, please? No. So unless anyone is against those minutes, please signify if you are against the minutes, otherwise we will adopt them. Okay, they are adopted. Thank you very much. Item 3 on our agenda is the local outbreak and evacuation plan monthly update, which is in the hands of our Chief Executive, Paul Masters. Thank you, Paul.
Thank you, Chairman. Good morning, colleagues. Obviously, as ever, an act with me and Tanya to talk about things from a local government point of view, and then over to Whitney from the sort of wider public health point of view. Firstly, of course, since the last time we met, the rollout of the vaccine is now well in earnest on the islands, and Whitney will give some broad updates later in terms of how that's going. Can I give a big thank you to all our NHS colleagues, on the islands and on the mainland who've been able to pull off that logistical feat, and as far as I understand it, is going well and giving some further confidence to the community of the light at the end of the tunnel. We mentioned lateral flow tests last time, and beginning the tests at the school, both for staff and pupils. Since that time, we've now also commenced lateral flow at the airport, and we have followed the national process of putting in an order for a wider number of lateral flows, which we're expecting to hear further news of probably this week. And then we move to how we are going to carry out using those lateral flow on the islands. And my working with Whitney and the Director of Public Health, we need to make sure that we prioritise that use in the best case possible, as opposed to it being a free-for-all for anybody asking for a lateral flow. So I think you'll have to sort of work with us for a bit. We want to work through that priority list of making sure that those frontline services come first, and then in terms of business usage, etc. But we will be doing that over the next week or so, Chairman. The next thing is grants. We are now distributing the mandatory and discretionary grants to businesses on the islands. I know that this time, as opposed to last time, the discretionary grant fund was undersubscribed, and it's the opposite this time. It's oversubscribed. So far, I think we've got £125,000 worth of asks for a £50,000 pot. So we'll be having to look through, again, making sure that those people who are the most in need have access to that money. So, but there should be money landing in people's bank accounts as we speak, and last week as well. Also, you'll have seen we've sort of upped the messaging in terms of the need for people as we roll out the vaccine not to drop their guard. This follows national guidance as well, and I'm sure Whitney will want to talk about that further. But there has been some sort of anecdotal evidence nationally through surveys, etc., that when people are vaccinated, they think that it's okay for them to go back to normal, which is not the case. And perhaps, Whitney, if I could ask you to give a little bit of emphasis on that in your Director of Public Health update, that would be good. And also, we've been doing some further work and increased activity in terms of ongoing enforcement checks, particularly in those retail premises that are open. And on that regard, big thanks to Darren and the police. I know, unfortunately, had to issue some fixed penalty notices last week, which goes to show that, again, people need to be reinforced the messaging of sort of not letting their guard down. Perhaps Darren might want to talk about that later, but thanks to him and colleagues in the police for their activities. Things that are also on my mind going forward, Chairman, is first of all, in consultation with you and the Vice Chairman, we've agreed with colleagues that we'll continue to offer access to the EVAC fund into the new year, so that as the tourist activity hopefully begins to be allowed to be open as we move into the spring, summer, there is another level of confidence that people might be offered should they be considering coming to the islands. So we will continue that into the new year. But obviously, we're still unclear, as everybody is nationally, about when things may or may not be allowed to open. And if I can remind colleagues that the funding currently to protect our transport network runs until the end of March. So I've commenced work this week with the Department of Transport and with operators to start thinking about if the tourist season is delayed into June or July, or maybe even later, let's hope not, that we would continue to need some ongoing subsidy to protect our lifelong transport services. So I'm beginning to do that work now, Chairman. And lastly, for those people who are interested, obviously there's been some confusion about the council elections in May and whether they will go ahead, bearing in mind the COVID restrictions. Currently, the government is sticking to the line that the elections will go ahead, as it needs primary legislation to stop them, and they've already been delayed for the Police and Crime Commissioner by a year. But door-to-door canvassing is not allowed. And all parliamentary parties received a letter from Chloe Smith, Minister of Constitution and Devolution, this week, making it clear that the government is still considering its position, is expecting to go ahead with the elections, but canvassing, door-to-door canvassing, is not an essential activity and therefore would not be allowed. That's all from me, Chairman. I don't know if Tanya wants to come in on testing at the moment.
Thank you, Paul. Welcome, Tanya.
Thanks, Paul. Morning, Chair. Morning, everybody. Just a brief update from me today on testing. So, as Paul's already mentioned, in line with other local authorities, we are reviewing how we can make the provision for the community testing and the use of those lateral flow tests here on Scilly, but we're not there yet. And Paul mentioned this as well. So, as you know, testing at Park House, the school, and now the airport staff began this week. The airport staff began this week anyway. And this is in addition to the testing that's already happening on the island for our NHS staff, so the ambulance service and the hospital and other NHS colleagues. And in terms of rolling out that wider lateral flow testing in the community, as you will have seen on the news over the last few days, we are obviously continuing to prioritise those front-facing services in line with national guidance. And we are, as a team, working really hard to develop those processes to enable us to roll out that wider community testing, and we'll hope to be able to update you further next time we meet. In terms of routine and symptomatic testing on the island, these continue to be done as a result of people contacting our testing helpline or as a referral from the hospital or local GP surgery, and it's working well. As you know, we've had a few issues with fog and flights last week, but that hasn't impeded us too much. That's probably all from me today. Hopefully we can provide you with an update on the community lateral flows next time we meet.
Thank you very much, Tanya. Does anyone have any questions, please, for Paul or Tanya on their update? I can't see any hands. Okay, thank you very much, Paul and Tanya. I'd now like to go to item 4 on our agenda, which is the Director of Public Health update, and I'd like to hand over and welcome Dr. Whitney Curry. Thank you, Whitney.
Morning. Thank you, Chair. Can you hear me okay? Yeah, thank you. Sure. So I'll start with sort of updates on cases that we've got in Cornwall and the Isles of Scilly. So at the moment, we're at 176.1 cases per 100,000. On the mainland, and that's come well down since the start of lockdown, where we were at 388 per 100,000 when we sort of started there. It took a while to get us over that peak of cases, but we've come well down now. It is certainly nowhere near where we were at the beginning of December, when we were more like 18 cases per 100,000. So while there's optimism there, we shouldn't consider the wave over, as it were, and we've still got community transmission on the mainland, and we've got to make sure that for your residents as well, who go back and forth as required by their needs, that we're still following all of the prevention behaviour. So it's really important. In terms of Isles of Scilly, no cases that we're aware of at present. And so my caveat there is always that when your residents go across to the mainland, if they stay for whatever essential need that they've got at the moment, they get symptoms and they get a test on the mainland, it's separate to our local enhanced testing on the Isles of Scilly, so it comes through another route. So it might take an extra couple of days. We don't know immediately. So that's just to remind you of that process. When you're tested on Isles of Scilly, we know who you are, we know your symptoms, we get you tested immediately, we know, we're assured that you're isolating. Tests on the mainland, we wouldn't necessarily know that until a positive test came through. But at the moment, I have no indications of any positive tests indicated for Isles of Scilly. In terms of updates since the last time, I know Rachel was here last time and I was here before, to let you know that our outbreak management plan that we have for the local incident response team is updated monthly, and so that has just been updated again, and it's always sort of a work in progress based on our learning, based on what's going on in real time. So to give you that assurance that that outbreak management plan has been updated in accordance with our terms of reference. Other things that have been going on are your vaccines on the islands, which has been really, really good. As Paul said, I really need to stress and make the point that even though you've been that many of you have been vaccinated, we don't know if you can still catch COVID even after you've been vaccinated. In the very, very controlled clinical trial, vaccines are 95% effective. That still means there's 5% out there who it might not be very helpful for, but we still do not understand yet the transmission of COVID even after you've been vaccinated. There's lots and lots of studies going on to help us to understand that, but for right now, we don't have the evidence, so we have to make sure, even after you've been vaccinated, hands, face, space, let's make sure that we're still adhering to lockdown guidance. And so I really commend and applaud our colleagues, police, transport, local authority, for really still sticking to that message and helping residents to understand that that is still very important. I know everyone will be very curious about what the uptake is specifically for Isles of Scilly. I don't have that disaggregated data. It's reported as part of Cornwall and the Isles of Scilly, and for everyone's information, you can find it on the ONS website, the uptake of vaccinations. I know I said it's lumped all together with Cornwall, but you can see that they separate it by the over 80s and under 80s first and second doses at the moment. So if you're curious, you can go, and they have a weekly data update, so you can see how we're progressing. And you can benchmark us against our Southwest colleagues. So far, it's been really, really good. Lots and lots of uptake across Cornwall and the Isles of Scilly. Probably the highest uptake of any immunisation we've seen. So that's really good, and it indicates that we could have a high amount of immunity moving forward. But as I say, not yet. It also takes several weeks for your immunity to kick in once you've had the jab. And again, we've only had first doses for the most part, and you do need that second dose to have your full immunity. So again, waiting till that second dose to make sure that you've got your full immunity. I know that there's lots of questions at the moment from people who are a little bit hesitant about receiving the jab. Both who have been offered it now and who may be offered it in the future. So I will be picking up on some of this, working with our comms colleagues and with the local authority, putting out a bit of a video, answer some questions, but really talk about what these vaccines do and what risks there are and are not with having the vaccine. But just in terms of a public health recommendation, if you're offered that vaccination, we would recommend that you take up that offer as soon as you get it. And that is not to shame anyone who has decided not to get it, but really to encourage those people who might be a bit hesitant, might be a bit worried, that it is very safe, and we would encourage you to take up the offer. That is pretty much it, other than to say health services on the mainland are still stretched. It's winter time, so that's just something to consider. If you've got appointments on the mainland, you might be starting to see lots more being pushed to virtual for a little while, and that is just an indication of services needing to cope with the extra demand in the winter. So that's just something to highlight for you as well. But that's my update, and I'm sure there will be questions, and I'm happy to take those, Chair.
Thank you very much indeed, Whitney, for your update. Councillor Williams, please.
Thank you. I think I've got two questions. One is around lateral flow testing and whether it might be appropriate for anyone returning to Scilly for either a health appointment or contractors or any other reason to have a lateral flow test to try and identify it early on if transmission has come from the mainland. And second, is there any thought of trying to get everyone on Scilly vaccinated prior to the reopening, when that happens to be, to again hopefully alleviate some anxiety about numbers coming into Scilly?
Okay. In terms of the lateral flow, so lateral flows are sort of a great thing, but also the bane of my existence, because they are not as straightforward as everyone would hope that they are. So lateral flows are really good at picking up really high viral load, and you never know if you've got high viral load, whether you're symptomatic or asymptomatic. And because of that, they're only really good for serial testing. So you want to make sure that you've got regular, at least twice a week testing to make sure that we're picking those things up. A one-off when someone arrives on the islands is not necessarily going to be extremely helpful. But that being said, those discussions are being had at the moment around the community testing with the lateral flows. So I don't want to say yes or no yet, but that prioritization is ongoing, and we'll be able to update you further at the next meeting. I know that seems like a not quite an answer yet, but those are exactly the kinds of questions that we're working through at the moment. Vaccinating everyone in the Isles before opening. I know this has been raised. I'm aware that it's being discussed at a national level. There isn't an answer yet, but I'm in the room pushing for that, and I know many of your NHS colleagues are as well. I can't make any promises there, but we have asked that be a consideration.
Thank you.
Thank you very much. Are there any other questions, please? Just one question from me, Whitney, please, which actually follows on from Councillor Williams. We've obviously seen the difficulties they've been having on Barra Island and the Shetlands in the last week or so, where they've unfortunately, had quite serious outbreaks. And bearing in mind the pressure on Trelisk still at the moment, I just, as I say, follow on from Councillor Williams to say, I think, it might be worth considering the difficulties that may happen here should there be serious outbreaks. I know we're considering this at the moment, but it might just make the case for the islands to get vaccinated as a whole, fairly soon, if that's possible, because of what may happen if we don't, and if an outbreak occurs. So just wanted to make that point. Thank you. Councillor Grosick.
Thank you, Chair. I just wondered whether or not there was any follow-up to Councillor Legg's question last meeting, where he asked for clearer guidance on support bubbles, which obviously are more appropriate if they're local support bubbles, but there was a question whether someone could have a support bubble with someone several, even hundreds of miles away.
I think in the guidance it would technically be allowed, but I think what we want to do is make sure that we're being really sensible about this. And if you're having people travel hundreds of miles, when they get someplace, they need to stay there, and you're now part of that bubble. What we don't want to see is people going back and forth hundreds of miles. That's the real issue and kind of the whole point of the lockdown. So being sensible in how we interpret that guidance is important. And then once you get there, let's, as much as possible, let's stay there.
Thank you.
Thank you. Stephen Taylor, please.
I'm sorry, Stephen. I don't know if it's me, but I can't.
Microphone, Stephen.
Oh, it isn't meant to be muted. It doesn't show as being muted.
There it is. You're back.
Now, thank you.
I see. Okay. Yes, I did check on that following the last minutes, and I came to the same conclusion as Whitney, that the same rules apply, whether it's 100 miles away or 1,000 miles away. So you are limited in the number of bubbles you can have. You're limited in the usage that you can make of them, and so the fact it's on the mainland is in effect neither here nor there. But of course, it makes a massive difference in terms of practicalities.
Okay, thank you. Are there any more questions, please, for Whitney? No. Well, thank you very much indeed, Whitney, for your update and for answering those questions. I'd like to move on to the next item on the agenda, which is our communications update. In your hands, Tom. Thank you.
Thank you, Chairman. I'll give a brief overview of some of the communications activities since the last meeting. I suppose I better start with the COVID positive cases announcement. It feels like a long time ago now, but it was just after actually the last meeting on the 12th of January we announced cases. It's the second time we've announced cases on the islands. Broadly speaking, it was well understood, the messaging, and as usual, with this sort of announcement, there's lots you can learn from it. So in this case, I think the thing that we learned was test and trace. There are aspects to test and trace that are just not that well understood by the public, and they're not that intuitive in some ways. And Whitney did a really useful video that was really well received for the public, just explaining how test and trace works, what they do, what they don't do, etc. So that's how that's what we learned from that recent announcement. Again, this month we worked with Darren at the police. I don't know if Darren wants to jump in after I've said something here, but obviously the police force had to issue some fines, so we helped them to share that message and amplify the message, because it's important as a sort of deterrent to other people who may want to engage in those sort of activities, that it can result in fines, and they're quite expensive in a lot of cases. Business grants has been very active from a comms point of view. As Paul announced, we've issued lots of grants, which are the statutory grants that everyone gets sort of automatically, but then there's the discretionary side of it, and even that's been, it's very heavily subscribed to. And, I think it's clear also from the hardship aspect, people who don't necessarily own a business, that, people are starting to feel the pinch at this time of year. So we're trying to reflect that in the comms, trying to signpost to the support that is available at the moment. Scams. We've been hearing about local and national email scams relating to vaccines, etc. Mainly national, but there have been a handful locally. We've been trying to just share the message about what you should and shouldn't expect if you're contacted by an official body such as the NHS. vaccinations has been covered earlier in the meeting. Our main messaging around that, obviously, it's a primary health issue. They've done a great job of rolling out the vaccine on the island, so it's fully their thing. Our messaging really is that public health thing. What happens after you've had your vaccine? At the moment, as things stand, you really do need to continue to follow all of the same guidance as everybody else, and that's the message we're trying to sort of hammer home at the moment until we collectively know more about these vaccines and the guidance can change. Our environmental health officer and licensing officers, they've been going around local businesses offering advice and support just to ensure that those businesses can offer their services safely to the public, or if they're not doing that, to operate safely for their own staff. So they've been doing actual visits on St Mary's to make sure that that's well supported. And finally, just to say we're continuing to issue the weekly chairman's updates. We've had positive feedback on those lately, so we'll continue to do those weekly so long as people are finding them useful. They continue to be available online by email subscription and in paper format from some of the shops on St Mary's and the off-islands. And they've been, I think, a useful digest of all the recent news we've had during any given week. So there's obviously loads of announcements, and we do try to sort of condense them into that chairman's statement and signpost appropriately. And that's about it from me. Thanks, Robert.
Thank you very much. Tom, are there any questions for Tom on communications, please? No? Okay. Well, thank you very much for that. And we'll move on to the last item on the agenda, which is if any of you please have any issues you'd like to bring to the attention of the board or discuss. Are there any other items from anybody, please? Paul, thank you.
It was only perhaps for the next meeting, Chairman. Certainly I've been raising, and I know a number of people have raised with me, questions beginning to emerge about where people decide not to take up the offer of the vaccine, whilst of course we strongly recommend that they do. What that means as an employer, we need to be very clear here that I've heard the words, it's a health and safety matter bandied about, etc. That's not true. Health and safety executive made it clear that's not true. But I have asked NHS England and NHS Region Public Health that at the next Outbreak board, I'm talking about the one that Rachel Wigglesworth chairman, we'll have a discussion about what advice we can give to employers and to people in the workplace. So I'll come back and update you on the board, and I'm just worried that there may well be some emerging tensions around that particular issue that we need to all be on the same page about.
Okay, thank you very much for bringing that to our attention, Paul.
Sorry.
Anybody else, please, with any issues or anything they'd like to raise? No? Well, thank you very much indeed. I'd just like to, from the chair, before we close the meeting, just to reiterate Whitney's comments and those of Paul and also Tom, that we must continue, whether we've been vaccinated or not, we must all continue, please, with the hands, face and space, and following the government guidelines to the letter. It's really important that we do this for our community and for Trelisk. So please bear that in mind and continue to look after each other and be safe. And thank you all very much indeed. Thank you. Close the meeting.
Thanks, Sharon.